So reactance, not quite resistance, because resistance is an interpersonal phenomenon between people. Reactance is rather a personality characteristic cutting across relationships. And like all good human behavior, imagine it on that normal Gaussian curve. So on one end of the continuum, you have the quite defiant, highly oppositional people.
Okay.
Arr, yes, the pirates. Don't tell me what to do, shrink.
Okay.
Then most people are in the middle, get along, go along. And then on the other side, not to get too pathological, you have the compliant, who in a pathological extreme you may want to even call dependent.
Okay.
And on the other side, of course, we have all kinds of access to diagnoses for the defiant, right? Antisocial, borderline, acting out.
Okay.
Well, why does that matter? Because as soon as you realize you have a patient on either extreme, very different treatment methods work for those people. Now, every seasoned therapist listening to us, Rich, can already identify this because early in their training, they found someone who was quite reactant, very oppositional to external advice, and they kept trying to pump away. So you have a bit of a battle of the wills, or a pissing contest, if you will. And then they said, that didn't go too well. No, that didn't go well. On the other hand, if I had a quite dependent patient seeking direction and advice, and I tried to wait them out, we'd have a very long therapy with little movement. So the match here is pretty easy. For the people in the 1/3 who are high reactant, defiant, FU types, if you will, then we know 3 things work far better. They are minimal therapist directiveness, to emphasize that client's self-control, and if one's ethically and practically comfortable, paradoxical interventions. And as you know, that's the kind of people that the early paradoxical therapists worked with. Sal Minuchin, Jay Haley, Erickson. These were not patients who were compliant and easily taken. On the other end, with the low reactants or more dependent patients, no one will be surprised to hear the therapy goes swimmingly when, at least temporarily, you provide a little more direction, support, and advice. Now, I can hear virtually every therapist out there saying, wait a minute, John, wait a minute. Don't I, therefore, just create more codependence by taking the high power route and being more directive? Well, that's true, but the paradox disappears when you make the distinction between long-term and short-term. Patients demonstrably do much better when they're compliant, perhaps dependent, by getting direct advice. After they secure some modicum of relief from their symptoms and feel better about themselves, then a secondary goal can be to transfer that responsibility and locus for therapy from less me as a therapist, more of you as a patient.